Thank you very much. So it's nice to be here again. So I'm Gillian, I'm the Associate PCN Director for Prevention, Partnerships and Transformation. I'm here today to talk to you about Talk Wellbeing, which is a new service that we are providing across Herefordshire General Practice. So the service itself is called Talk Wellbeing. We're aligning it with the Talk community because I think it's really important. This is how we're working within our communities and for our communities to support our communities. So what is Talk Wellbeing? So the purpose of it. So really it's a preventative service. What we're trying to do is work with people in the communities to detect those who are at risk of heart attack and strokes early on, so cardiovascular disease. We're really looking at how we work with our underserved communities, so we're looking to take our service out to those areas, those community groups, working with BCSE organisations who actually are working with people who may have barriers to accessing services and may be at high risk of cardiovascular disease. So some of those target populations that we're looking at are unregistered populations. We're looking at working with seasonal and farming communities, so we're attending the Livestock Market at the moment, but looking to broaden that engagement. Those living in areas of high deprivation, as you'd expect. Hesitant populations, those who English is not their first language. Migrant communities, rural communities, I mean that's an awful lot of this county. And those that are digitally excluded as well. So those that may not be able to access things online and need that extra support and help, then we are there to help them. The service itself is very much like an NHS health check, but actually we've removed an awful lot of the criteria that you would need to meet to have an NHS health check. So we're calling it Health Check Plus-ish. Basically anybody that's 18 plus can access this service as long as they are living in Herefordshire. We're trying to detect atrial fibrillation, we can do blood pressure checks, cholesterol checks, generic health and well-being screening, but also signposting. So we're working, we're just employing 2 social prescribers, but we've currently got a social prescriber as part of that team. So as well, that individual will be working with communities to build up that trust and that engagement, but is also there when delivering the service, provide advice and signposting to individuals that may approach. And often people may not want the full health check, they may actually just need that support to understand where they can access services that will help them. We'll also support people to register at practice, so we have quite a few people in Herefordshire that are unregistered at the moment and are unable to get registered because of barriers, so actually our service can help them to do that. Where the social prescriber will work with them. If we detect any clinical need at that time being, we'll support them while we're registering them at practice as well, using our evening and weekend and out of hours services. So taking that 24/7 general practice approach, we're able to support those individuals while we register them. We can also do COVID vaccinations through the outreach part of that programme in line with the seasonal vaccination programme. So at the moment, if we're out in the hospice van, which we borrow from them, we will be able to provide health checks for people and COVID vaccinations if they fall into any of those eligible cohorts, like I say, in line with the vaccination programme requirements. We have a team of individuals, and that team will change and flex depending on where we're going. So for some people, places, it will just be a very small group, very small numbers. So we'll send our social prescribers out, and when they start and post, we'll be training them to do health checks as well. We can also send out healthcare assistants and nurses, and the team are supported in the background by our GPs. So if we identify any clinical risk or need that needs escalating quickly, we have that support in the background from the wider team. And as I said before, it's an outreach approach, so very much within the community, and that can either be in buildings such as the Kindle Centre, we're at Hinton, we're at Ross Community Gardens, so we're in greenhouses. We're really flexible. As long as it's clinically safe and private, we can run from there. And also we borrow the hospice bus, so we can park up in Tesco's car park, for example, if there isn't a space inside. So we've been running since mid-June. We really started in July, very slowly, just to get a feel. So far we've supported 117 patients, 58 on referrals from that, and we're seeing 23% of patients record an increase in their activation level. And what that means is their confidence to manage their own wellbeing. So through the advice and information they're getting from us there, they feel more confident to manage their own health and wellbeing, which is, I think, what we all really want. It's that strength-based approach and how we empower individuals. I won't run through all of this, but we've identified 3 people that haven't been registered, and we've managed to get them registered and the support that they need. 22 people with high blood pressure, 24 with high cholesterol, and 138 contacts with a social prescriber. And for me, that really demonstrates actually this is about building trust in those relationships and that onward contact afterwards. It's not always just a one-off intervention that somebody needs, particularly with some of the communities that we're working with. That building the trust engagement is absolutely key, and that's why we're seeing those contacts with the social prescriber higher than the number of checks that we complete, and that's really important. Some of the key themes that we're seeing at the moment is homelessness. So we've been working with the living room, going in there, I think it was twice a week to start with, wasn't it? And we're now every other week in there, so regular attendees there. A lot around access to food and housing, signposting for benefits reviews, and some are just too busy to go to their practice. And we really picked that up when we went to the Livestock Market, that people weren't coming to their practice. They probably were aware of something, but they are simply too busy. But having that professional there that can do a check, provide them signposting and get them into a GP appointment if they need to, has been really valuable. So some of the events for this month, so on our website we have on the Taurus healthcare website, we have a list of all the events that we've got, but this month we'll be at the Livestock Market again, so we're aiming to be there every month now. We'll be in Tesco's Belmont every other Friday. We are working with the cart sheds to be there. I think we were there last month, and we'll try and be there every month. Various different groups. Asda, Ross Community Gardens, which is going really well. We're working with the health lifestyle team, so we can try and join forces. So if they're out seeing individuals and we can send a member of our team, then we'll do that. It's not about sending everybody all the time, but understanding what the best combination of people are for that event. Working with the living room, and we're looking at Morrison's to do a real focus on detecting atrial fibrillation. So a little bit of feedback from the Livestock Market. So we took the outreach vehicle, we saw 19 patients. A health check takes quite a long time, so we take a couple of people out. It can take 30 to 45 minutes to a health check and signposting, so we won't expect to see big numbers through this. Out of those, we had a couple of individuals that needed, or one in particular, needed access into a GP appointment urgently, so the team were able to phone their practice and get them an appointment for that evening. So again, we're able to link back in because we've got that one Herefordshire general practice approach, we're able to link in that way. Some of the feedback, my blood pressure won't be good, I'm about to pay for a pen of views, shows the pressure that people are on, but really lovely to capture that. Wish our health service would do something like this, what a great idea. We're seeing a lot of people from out of county at livestock markets, so at the moment this is a Herefordshire contract, that's how it's been set up with the commissioners. We are looking this afternoon at an out of area pathway because we would like to be able to support anybody that comes to us, so we need to work on that with the commissioners. What are you offering? I've not seen my GP for 15 years. Again, so busy, just can't do that. So we're making ourselves accessible. I think most people in here will know what the living room do and what they're about, but it's been really helpful being working with Mel and the team so closely. So we've been in there every other week now, and the social prescriber I think has been really instrumental in the work that they've done with individuals there. And again, it's about the engagement, building up that trust, and the team at the living room are able to bring individuals to meet our team and make that introduction and make people feel safe and welcome. And I think that's so valuable about how we all work together to deliver this service. Got a couple of case studies for you. So this really shows again the benefit of the team and working with that social prescribing approach. So somebody came for an appointment, had that cough, struggling with bereavement. And when you look through and the support they've got, then we managed to refer them to their own GP to practice to check their chest health. We made a referral to the hospice for some bereavement support and to Hope. And the outcome was, well, really positive, as you can see from that. And the second case study, patient feeling lonely and isolated. And I think, again, in the communities that we're working with, this is something that I think we all know is a particular issue with the rurality in our county. And actually the outcome there was that the patient felt more positive and beginning to set that sense of community and belonging, which is so important when people are trying to manage their own health and well-being. Looking at groups that they can link within, and then the patient was less focused on the medical issues and more focused on creative outlets. And again, we know that those social impacts so often impact on people's health, so really important we look at people as a whole and holistically. Patient feedback has been really positive so far, so again, helpful, not judgmental. Jane is our social prescriber, so very impressed, wasn't aware of the service, so this is why we're here today, to promote this with you all, so you're able to let people know as well what we're about and where we are, which is what I've really valued from today. And finally, I think why we're here, really, not just to tell you about the service, but actually in this way of integrated working and working more closely with VCSE and community groups. We want to know how we can work much more closely together to understand how we can reduce people's risk of heart disease and stroke. So we can offer drop-in sessions at community groups, events, we can use our outreach vehicle, as I've said. We need to know from all of you, from our communities, where you think we're best placed. Do you run a community group or an organisation? Would you like us to come and engage with those that you support? And could we run some services, some sessions from your groups? Do you know of particular target cohorts that we should be looking at, particular areas we should be? So really keen to know from you all and to work with you on that. On our website there's a link, I think the slides are sent around, aren't they, Christine? Yeah, so this link will take you to our website. There's a form on there if you'd like to engage with us and for us to come out to one of your groups. Fill in your details on that form, one of our team will contact you and we can arrange it to learn a bit more about what you do and get some dates in the diary to come and work from your group. And if you've got any other queries, we've also got an email address there, so again one of the team can get back in touch with you, talk through in a bit more detail what we do. You might want to come out and see and just engage with the team, or equally we can bring the team out to you and meet that way. So I will pause there. I'm happy to take any questions on that if you have any.
Has anyone got any questions for Gillian?
What was the breakdown in ages of the people you've been supporting?
It's a good question. We have the demographics. Off the top of my head, we're fairly spread, probably with the majority from, I think, 45 to 65, but we can support anybody 18 plus.
Hi, sorry, I used to work at the Stroke Association and we were covering Worcestershire mostly, and I covered the part which was just on the border. So I'm just wondering, have they engaged in any way? Is there any move towards improving that kind of knowledge from their knowledge base?
Yeah. So the really good news about this service is it runs over Worcester as well. So we're delivering the Herefordshire part. There is a similar team in Worcester that do the same over there. So we have the opportunity to break down those barriers between our two counties, and that makes it much simpler. It's when we're looking north into Wales at the moment it gets a bit more complex, but we hope to resolve that as well.
Actually, it's not a question, it's just a comment really, that I think this is wonderful. The problem with screening services that I've seen exist before is that the ones who need it least are the ones that attend the most, whereas you're making real efforts to engage with people who will benefit most from screening. I think it's a wonderful idea and programme, so yeah, congratulations, well done.
Brilliant. Thank you, Andy.
Thanks, Gillian. I just wondered if there's an opportunity, if we did something in rural areas or wherever it might be, that we all join, some partners joined you, rather than just run them yourselves, because our experience within the voluntary sector is that it's the relationships, as you quite rightly said, that are developed, and partner agencies, we might be able to maximise what we do together if we joined you.
I think that would be perfect. I would really like that. I think that's really important. The next part we'd like to establish is a group of partner organisations working together to understand who's going where. You know, we've got so many buses going out to do outreach, and actually it could be about, you know, what's right for that location. So I think you're right, Will, if we could set that up, that'd be great.
about some of the things that you'd mentioned that you're helping with, and things like people finding it difficult to be able to engage with their GP, to maybe register because they're hitting those barriers. So with that information that gets given back to you about why they've hit those barriers, will anything happen with that to change how people can then access their GP or anything like that? Because I think this is amazing what you're doing, but if it's only a small percentage of people who are being hit, there'll be other people who are having the same thing happening. So it's kind of like a group of people who are able to be the voice for other people. So it'd be interesting to see how the feedback that you're getting will then be used to implement changes ongoing in the future.
I think that's really important, and that engagement and feeding that back, I think, is so powerful, and we should be embedding this in the work that we do. So we make sure that we capture feedback from everybody. We meet with the commissioners every month on this and provide that feedback. So there's probably the two parts. There's some things that we hear that we can probably ourselves change very, very quickly, and we're, in general practice, in that way, we're quite adaptable, so we're able to do that. So, for example, we're hearing from the livestock markets they want to know more about skin checks. Now, whilst we can't do skin checks, we can absolutely promote what to do about it, when to recognise signs and symptoms, and how to then go forwards from there. But there are the large pieces, aren't there, around commissioning intentions, so we can also collate that and feed that back in.
Fabulous. Thank you very much.